For the North Coast.
Madam Speaker, the Health Minister suggested on Monday that cleanliness wasn't part of healthcare. However, keeping a clean hospital, as the Minister discovered in Burnaby, is what can prevent C. difficile outbreaks. Keeping a clean hospital is the best first line of defense against superbug outbreaks. Does the Minister stand by his claim that cleanliness isn't part of healthcare?
Minister of Health.
Thank you very much, Honourable Speaker. And I was very clear the other day when I said that cleaning and doing laundry services was not frontline health care. Not that it wasn't important. Of course, Madam Speaker, in an environment where people are susceptible to infection, cleanliness is absolutely important. That is why, Madam Speaker, that's why at Burnaby General, Madam Speaker, they were able to reduce their C. difficile rates. You look at the improvements they've made are truly remarkable, thanks to all of the staff, cleaning staff, nursing staff, all the professional staff at Burnaby General Hospital. We make sure, Madam Speaker, through the health authorities that cleaning is audited and that the results are satisfactory to keep driving down the rates of infection in hospital.
For North Coast on a supplemental.
Thank you, Honourable Speaker. The Health Minister knows that living in the interior means living with delays because of closed roads and closed airports. So a plan to ship laundry to Alberta or to the Lower Mainland carries a real risk that hospitals in places like Nelson and Golden and Williams Lake and Kamloops will be without clean sheets for no other reason than the weather. That's why the Minister's plan to fire 175 workers in hospitals across the region could have real impacts on healthcare. Will the Minister admit this is a foolish plan that could seriously impact healthcare and stop it in its tracks today?
Minister of Health.
Thank you, Honourable Speaker. Well, Madam Speaker, the member opposite might be interested to know that we folks in the interior actually have electricity now and televisions and all kinds of things in the modern world. We do not worry, Madam Speaker, about accessibility. We have great functioning airports. We have great highways. And Madam Speaker, we have great people working in the healthcare system in the interior. The objective of Interior Health is to make sure they get best value for money, Madam Speaker, so that money can be used for frontline health care. As I said, on this side of the House, we will buy endoscopes over washing machines any day of the week.
Member for Nelson Creston.
Madam Speaker, I'm glad the Minister realizes that we have electricity, because the other day he didn't realize that cleanliness is actually important to health care. An idea that comes right out of the dark ages, Madam Speaker. Vicki Harris is a constituent of the Minister of Health. She is a single mom of 3 working at Royal Inland Hospital in the laundry. She does her best to make ends meet. She shops in Kamloops, pays taxes, and contributes to the local economy. Doctors, nurses, care aides, everyone on the healthcare team know her work is imperative to the healthcare system. Why doesn't the Minister?
Minister of Health.
Well, thank you, Honourable Speaker, and the work of all Interior Health Authority employees is valued, Madam Speaker, but at the end of the day, the goal of the Health Ministry and health authorities is to follow the principles of the Institute for Healthcare Improvement, which means that we get better outcomes for patients, we get better population health, and we get value for money. Madam Speaker, we look for efficiencies on this side of the House in our core government. We expect health authorities, school districts, other organizations to look for savings as well. Madam Speaker, we want to make sure that healthcare dollars are providing frontline healthcare, more hip surgeries, more knee surgeries, more endoscopes.
Thank you, Minister. Member for Nelson Creston on a supplemental.
Thank you, Madam Speaker. Well, Irma Stretch is another Kamloops resident, another constituent of the minister who is on the front lines of healthcare, and she works in the laundry. And she's very efficient at making sure there are clean, sterile sheets for everything from x-rays to the operating rooms. Madam Speaker, if those sheets aren't available because they're stuck somewhere on the Coquihalla in bad weather, and the minister knows that bad weather happens in the interior just as much as I do, no one is going to be getting their surgery, Minister. So how can the minister be so out of touch with his constituents like Vicky and Irma, who play a vital role in the healthcare system?
Minister of Health.
Well, thank you, Honourable Speaker, and I had an opportunity to be in Kelowna General Hospital, where a good friend of mine, happens to be my father, is being well looked after by the staff of Kelowna General Hospital, Madam Speaker. And in fact, the food which he is eating comes from Vernon, which is up the highway from Kelowna. And he remarked at how much he enjoyed the food and the care he was getting in Kelowna General Hospital. The fact is, Madam Speaker, the members opposite make it sound like these are small villages in the middle of nowhere. Transportation systems, logistics, are pretty sophisticated all over the province, Madam Speaker. I'm sure that we can manage to get laundry services and have that laundry delivered around Interior Health as necessary, getting good value for the taxpayer, making sure we can do more hip replacements, knee replacements, and colonoscopies, and all the other medically necessary services that people in British Columbia need.